I think it's extremely important that when you explain a disease, you really explain who is most at risk. And I think this was done brilliantly in Nigeria, to explain that this is a disease that you get from who is sick or who is dead, not somebody who has a vibe absolutely fine and walking around and doing a jogging. And so understanding who is most at risk, which is people who are caring for the sick and the dead, was one information that I think in Nigeria was given very well. And the second thing that Nigeria did well, and other countries who are not overwhelmed with so many cases did well, is that they showed that with intensive care, you can do a lot on mortality rate with Ebola. So I don't think we should wait for a vaccine or a treatment or whatever. I mean, we did show that with proper intensive care treatment, and I agree this depends on the number of cases you have, but with good intensive care, you have very good survival rates. And I think that if this is part of the sensitization, that you explain who is at risk and why one is more likely to die, I think the sensitization makes a big difference. And I have seen this in Senegal, and I have seen this in countries which were not the three intensively affected countries.
The last question to the three of you: what do you think is the most important step to do this year, that there are not more cases again of Ebola outbreaks in the affected countries? What would you do immediately if you had it in your hands with enough money and enough people?
Proper surveillance is a key to, in the next coming weeks and months. And also there, again, we have to mention WHO has to play a stronger role. Surveillance across, the borders, and there is still no regional approach. It's still, very country by country. So proper contact tracing is key to it. The number of health staff, I think what we see, it's still they're not protected well enough. The local health staff working in Ministry of Health facilities, they have to be protected, they have to be trained well, and those are the ones who really carry the burden of the disease.
I don't think we can work against the very people who we work for, and so we have to listen to them. So what I would want for any other epidemic is really to have a real honest debate with populations when they have concerns, when they're not happy, to hear what they say and listen to their proposals.
Well, I think the key of actually getting a grip on this epidemic is a behavioral change. And not only the behavior change on a national level, but really going down to each ethnicity, to each village, and really liaise with the opinion leaders there and really influence people to change their behavior. And there the communication people will have a stake in it.
Den Abend, wir consider we all
ja, das war eine tolle Veranstaltung, ja, und vor allem der Beitrag von Fatou aus Senegal, ja, war wirklich authentisch, und ich habe da wirklich auch so eine kulturanthropologische Sichtweise oder Ansatz, der hier sozusagen experimentiert wurde.
Was wir jetzt am Ende der Diskussion, also etwas abgegangen ist, dass man den Blick in die Zukunft richtet. Denn wir wissen, dass diese Epidemie in den 3 Ländern eigentlich eine Situation hinterlassen hat, wo man bei vielen Punkten fast bei Null anfangen muss. Bildungssystem, Gesundheitssystem, Landwirtschaft. Und hier zu investieren und hier sich neben Ebola jetzt mit diesen Defiziten zu beschäftigen, das ist eine der großen Herausforderungen. Und das ist mir ein bisschen in der Diskussion abgegangen.
I believe in discussing, where people meet and discuss about a specific theme. And Ebola, I've been known about Ebola from different perspectives, from the media, from people, from small groups.
There are people in Austria, in Vienna, who care what's going on in other parts of the world. Africa has 54 countries. In 3 countries we have this problem. So I think for the other 51, there's not a big danger. And I really see another danger, that through Ebola we exclude a whole continent. Through Ebola we exclude many people. Through Ebola, even in these countries, there is now a stigmatization that local people don't want to deal with the so-called survivors or also with the health staff because they're afraid. I think we should think about this what kind of exclusion we are now facing through Ebola.